You're watching Stroke Prevention and Education by Dr. Alyssa Gall on Resonance Wellness TV, part of our Whole Life Medicine Alleviated series. Keep in the loop about future webinars and events on whole-life-medicine.com. So hello and welcome to Stroke Prevention and Education. My name's Dr. Alyssa Gall and I'll be your guide this evening about this exploration of a condition that tends to strike unexpectedly. And as usual, this presentation is given in the context of the whole life medicine model. And this is the model I use at Resonance Wellness when I'm evaluating your healthcare situation. And today we're going to take again a look at the setup aspect of Alleviate. And this is, stroke is one of those conditions that's so related to many of those that we have gathered to learn about over the years. And I'm sure you're going to hear many things that we have discussed before. There'll be a little bit of a broken record aspect to it. That's good. We're reinforcing, or I guess over the years, we're reinforcing all the ideas that are really important. So let's start with looking at what is a stroke. A stroke is what happens when blood flow to an area of your brain is cut off. So blood is obviously carrying oxygen to the cells of your body, and that's true all the way to your brain cells. In fact, your brain cells take a lot of oxygen and nutrients to run. And when you can't get the red blood cells into the brain through the capillary system, brain cells quickly suffer. So stroke is a medical emergency, and it's very important to get treatment as soon as possible. Some treatments actually only work if given within the first 3 hours, and so a delay in treatment can increase the risk of you having permanent brain damage or death. It is certainly a time-sensitive condition. So as a consequence, there is an acronym for the 4 major signs of stroke that you should be able to recognize. And the acronym is FAST. So the first F stands for face drooping. So if you ask the person to smile, does one side droop? The second is A for arm weakness. Ask a person to raise both arms. Does an arm drift downward instead of being held upward? And S stands for speech difficulty. So if you ask the person to repeat a simple sentence, are the words slurred or unintelligible? And T is basically time to call for help. So if you see any of these signs, you're going to call 911 or whatever your local emergency hotline services are if you're not in a 911 area. And it is very important to act quickly because, like I said, there's certain medications that are used which are really only useful done quickly. And we're going to see a little bit why that's the case in this next couple of slides. There are other symptoms as well that you might be looking for. Certainly the face drooping, arm weakness, and speech slurring that we just discussed covers the most common symptoms of stroke. But other sudden symptoms that somebody is having a stroke might include numbness or weakness in the face or potentially in the leg, especially on one side of the body. And this is part of the test. You know, you're basically looking for things that are asymmetrical, because it's rarer to have a stroke that would affect your whole brain because of the way that the brain is split into two. It has kind of, in a way, 2 separate main trunks going to it, your carotid arteries on either side. And it has a little bit of circular circulation in the base of it. But often strokes are happening on one side or the other. And this is the reason why we're doing the comparative symptoms. It might also be that somebody who's having a stroke in front of you doesn't understand what you're saying. Or talks nonsensically to you. They may also complain they're having trouble seeing out of one or both eyes. They might have a problem walking or staying balanced or coordinated. They may also be dizzy, and they could have a sudden onset severe headache. So you can also have stroke-like signs in a migraine. And the reason that you can have stroke-like signs in a migraine is the migraine also affects the circulatory system. So it isn't unusual for certain types of migraines affecting certain parts of your brain to create stroke-like symptoms. But usually you wouldn't have the sudden onset of a migraine, especially if you've never had migraines before with stroke-like symptoms. However, I have had patients with migraines where they were concerned they having strokes, and it just turned out they were having a migraine. In a migraine, you basically have changes in your circulatory bed, either restrictive, which often creates kind of stroke-like symptoms, or the more common is when you have kind of blood ballooned out someplace that's filling your head and creating pressure from the inside out. But so if you have a migraine, migraines, you don't want to completely dismiss that, especially if there's weakness. And you can quickly rule that out with a scan. Now, like I said, every minute is really going to count. If you're going to call or drive yourself to the hospital, it does waste time. If you get an ambulance and ambulance worker can come, it boosts your chance of getting the anti-thrombotic treatments that you need. So they're basically going to be administering treatments that break up clots. So if you notice any of these symptoms that you've discussed so far, and especially if it's concerning another person that's in front of you, sometimes people have trouble recognizing that they're having a stroke. Other times it's very obvious, but they try to ignore it. It's really important that if you suspect that, just call the paramedics. It's better to be safe than sorry under these conditions. Now, there's three main kinds of strokes. The first we're going to discuss is the ischemic stroke. So that's known as a stroke caused by a blood clot. And that's really accounting for about 87% of all strokes. So this is the kind of stroke that we would normally give the blood clot buster for. And an ischemic stroke is occurring when a blood vessel that supplies your brain becomes blocked and it impairs blood flow to that part of the brain. So the brain cells and tissues are going to begin to die within minutes from lack of oxygen and nutrients. And ischemic strokes, so basically this blockage type of stroke, is divided into two groups based on what type of obstruction has occurred. The first is a cerebral thrombosis. So a thrombotic stroke is a stroke that's caused by a thrombus. So that's the Latin for the word blood clot. So basically, it usually develops in the arteries supplying blood to the brain. So that kind of stroke is usually seen in older people, especially those that have atherosclerosis. So that's an inflammatory plaque inside the walls of your blood vessels. Or they might have diabetes, because uncontrolled blood sugar actually increases atherosclerotic types of damage to your vessels. So sometimes symptoms of a thrombotic stroke really occur suddenly. Often they'll start during sleep or in the early morning, and at other times it can occur gradually over a period of hours or even days. Thrombotic strokes are usually preceded by one or more little mini strokes. So the person's having what's called a transient ischemic attack, or a TIA. People have often heard that term. So a TIA might last for a few minutes or all the way up to about 24 hours. And that's usually a warning sign that a stroke can occur. They're mild, they're transient, obviously, hence the word transient ischemic attack. And the symptoms are similar to those caused by a stroke. So if you get signs like that, it is very important to get that checked out, even if they actually resolve, because it could be just a warning sign of something major that might occur. Now, another type of stroke that occurs in the small blood vessels in the brain is called a lacunar infarct. And the word lacunar actually comes from the Latin word meaning hole or cavity. And this occurs when a blood clot is forming in the brain's own venous sinus. So there's a channel between veins in the brain, and that prevents blood from draining out of the brain. And so as a result, you can get a leak into the brain tissue, forming a hemorrhage. This is often found in a person who has diabetes or high blood pressure. But it could basically happen in people of all ages, including children. and even newborns. So it's not usually a thrombotic clot in causing a stroke in a child. It'll be something more like something occurring in the small blood vessels of the brain, independent of a clot traveling through. Now, the second cause is it's called cerebral embolism. So this is a clot that forms at another location in the circulatory system. Usually it's coming from the heart or the large arteries of the upper chest and neck. And that occurs when part of the blood clot breaks loose and it's going into the bloodstream, travels through the blood vessels into the brain, where if the clot is large, it can wedge into a blood vessel that's too small to let it pass through. So a leading cause of this kind of stroke or cerebral embolism is arrhythmias. So an irregular heartbeat. That can actually cause a clot to form in the heart and dislodge and travel to the brain. So this is the main risk with an arrhythmia, especially arrhythmia that is very consistent. Now this is different than people having palpitations necessarily, to be clear. So an arrhythmia is where there's an electrical disturbance in the way that the heart is beating, and that has usually a very regular, like all the time sort of activity. And it's not usually as perceivable by the person who is having the arrhythmia, although the odd arrhythmia will create fast heartbeats where people are aware of it. But that kind of like bump that you get sometimes under stress at night, that's not technically an arrhythmia. It feels like one, and it feels like there's something wrong with your heart, but that's not actually what that is. A true arrhythmia, like I said, is more of an electrical problem, and it actually comes from the heart electrical system itself. It doesn't come from outside. So you are, though, more likely to form a blood clot to your brain if you are on hormone medications such as oral contraceptives and even post-menopausal estrogen therapies. So this is always a consideration when we have those medications prescribed. They do increase your likelihood for clotting. And often in oral contraceptive use, as an example, it's not unusual to see clots, especially where other basic things like hydration are not taken care of. So it just makes you more likely. It's more inflammatory. Now, the second form of stroke is hemorrhagic stroke. That's about 13% of stroke cases. And these are caused by a weakened blood vessel that ruptures and bleeds into the surrounding brain. And when it does that, it compresses the brain tissue, kind of like having like, because the head is a restricted area. If blood leaks, it starts to basically put pressure on the surrounding brain tissue. And it's actually the pressure itself causing the lack of oxygen and nutrients. So if it's bleeding onto the surrounding brain, your brain actually has quite a number of major vessels running through the sulci on the outside. So if I know we see cartoon pictures of brains and they don't really have blood vessels on them usually, but there's actually tons of blood vessels on the outside of your brain, and they're kind of held right on the surface there. And so if there's hemorrhage in one of those, and then there's not much room, like I said, between that and the skull, so you're actually producing like a liquid blood area, creating a pressure. So there's two types of weakened blood vessels that usually cause a hemorrhagic stroke. One's called an aneurysm, and the other one is an arteriovenous malformation. But the most common reason why people have hemorrhagic strokes is uncontrolled high blood pressure. So, where the blood pressure is routinely climbing into the very, very high 100s, and where the bottom number is climbing, into the 100 range regularly. So those, the other risk factors there are going to be things like being older. So as you get older, your stroke risk increases. Men are more likely to have strokes. High blood pressure sufferers are more likely to have strokes. Excessive alcohol intake often creates hemorrhagic stroke. And like I said, having an arteriovenous malformation, so that's a developmental condition that is occurring when the blood vessels don't form correctly. So you might not be aware of having an arteriovenous malformation until you have a stroke involving one. It's not something, though, that is genetically passed on. It's a condition that develops in you, like as an embryo, when you're actually forming your brain. If you are on anticoagulant or blood thinner medications, that makes blood bleeding into the brain more likely, especially if you're not taking it properly or you're taking it in large doses. You will know that that's the case usually because you will be bruising more on the anticoagulant. You can also get a hemorrhagic stroke from damage from trauma, like a blow to your head. Or like a car accident would, as an example, be a really common place where you might induce a hemorrhagic stroke. So an aneurysm, like I said, it's a weak area in a blood vessel that usually enlarges. It's often described as a ballooning of the blood vessel, and they usually expand slowly and become weaker as they grow, just like a balloon becomes weaker as it stretches. And people aren't usually born with aneurysms. They can form from blood vessel disorders, infection, drugs like amphetamines and cocaine, because they tend to very rapidly increase the blood pressure suddenly. That's what amphetamines and cocaine do. Or direct brain trauma, like I said, from an accident. So if one aneurysm is forming, there's about a 20% chance that at least one other one will form. So small aneurysms don't have any symptoms, but as it enlarges, it can produce headaches or localized pain. And as it expands, it can create pressure on healthy brain tissue or adjacent nerves. And like I said this already, but arteriovenous malformations, they don't look like this. It's not a knot. This is a clever diagram, but it is really not an accurate picture of anatomical reality. But arteries that can carry blood from the heart to the brain, veins carry blood with less oxygen away from the brain and back to the heart. So if there's an arteriovenous malformation, there's usually a tangle of blood vessels that are bypassing healthy brain tissue, and it's where the blood is kind of going directly from the artery to the vein. So less than 1% of the general population is going to have an arteriovenous malformation that would make them more susceptible to certain kinds of stroke. And it's more common in males than in females. And like I said, usually somebody's born with it, but it's not inherited as a genetic condition, and it won't be passed on to your kids if you have that. So as the heart beats, it pumps blood around the body through, like I said, a network of arteries. And what you're really doing when you are circulating your blood is you're basically supplying nutrients and oxygen to every cell in your body. So your muscles are getting the energy and oxygen they need, as is every other kind of cell type. And as the blood is traveling through the arteries, it pushes against the side of the blood vessels. And the strength of that pushing is called the blood pressure. So there's like a basic like resting pressure in the blood vessels. So that's the bottom number of your blood pressure. So that's the diastolic reading. So if you have like a blood pressure of 120/80, what that means is 80 is like the baseline pressure. So that's the bottom minimum pressure that your system is always under positive pressure. You never have zero pressure in your vessels. If you do, you go into cardiac arrest, basically. So you need some blood pressure in there, otherwise you'll be very faint. And then the top number is as your heart is squeezing and pushing the blood through your arteries, the blood pressure goes up in waves. So, and then as your heart relaxes, the blood pressure goes down. So with each heartbeat, your blood pressure kind of rises to a maximum and then falls to a minimum. So we're basically seeing that one number, the highest number, systolic number, is the maximum that pressure that's achieved, and that's as the wave of blood is coming out of the heart down the vessels. So high blood pressure significantly increases the risk of hemorrhagic stroke because it just basically means that your heart is under more stress. It's working harder to transport blood. It's expanding and traumatizing the blood vessels, because the higher the pressure on the blood vessel, the more repair the blood vessel has to do, the more susceptible it is to having problems that you're constantly going to be trying to repair with inflammatory plaque producing processes. So men, as you get older, people who smoke in particular, people who drink alcohol, if you couple that with high blood pressure, you're at a higher risk of stroke. But what's really interesting to me is that there was one study that was done, for example, and this was done with about 26,000 people of all races, aged about 45 plus. They were followed for about 6.3 years in this study that was called The Reasons for Geographic and Racial Differences in Stroke. And all of these patients, or at least half of these patients, I think it was 12,000 of them or so, were successfully treated hypertensives. What that means is their high blood pressure treatment had their systolic blood pressure less than 140 on the top. So that's the goal level. And there were 4,000 or so unsuccessfully treated hypertensives. And at the end of that 6.3 years, more than 820 of those people had experienced a stroke. And what they found was that basically, even if you had controlled blood pressure, if you compared to people with a blood pressure below 120 milligrams of mercury, that's just the 120, that's the measurement of the pressure without treatment. A hypertensive individual that had 3 or more blood pressure medication actually still had a stroke risk that was 2.5 times higher. So you're in a lot of trouble by the time you're on several medications, even if they achieve excellent control. So the way to curb the problem is actually to prevent the hypertension in the first place. And we're going to talk about some of those obviously in a moment, but the obvious things are taking part in moderate physical activity, keeping your weight in the normal range, and eating a proper diet. And we're going to talk about this again. I know you sometimes probably feel like I'm a broken record in the diet department, but honestly, it is absolutely crucial to decrease stroke risk and to also treat high blood pressure. Now, again, the transient ischemic attack is the mini stroke. So it's a major warning your body's not functioning and that a full-blown stroke could potentially be ahead. So what that is like a temporary blockage of blood flow to the brain, but the body basically rectifies it. So it can use natural clot dissolvers to do, and the blockage isn't in place long enough to do any damage. But a TIA happens probably before about 15% of all strokes directly. Up to 25% of people who suffer a TIA will actually die within 1 year. So it is a good measure of something's not right. And about a third of people who have a TIA go on to have a more severe stroke within 1 year. So it is a great warning sign to do some things differently. If you suspect that you might have had one of these, it's easy to start to make some changes. And after a stroke, a TIA also becomes more prevalent. So if you've previously had a stroke, you could actually have more of these little warning signs, the same as a stroke, but maybe not as severe. And, does anybody know now, like if you didn't look back, what is the FAS standing for? Do you remember? If you remember, F is face drooping, A is not being able to raise your arm, S is speech slurring, right? And T is time. Means that if you notice those things, don't take any time, call 911 right away. Do you remember that? Awesome sauce. And like I said, 1 in 5 women in North America is going to have a stroke in their lifetime. Stroke kills twice as many women as breast cancer does. It makes it the 4th leading cause of death for women. Stroke kills almost the same number of men each year as prostate cancer and Alzheimer's disease combined. It's a big cause of death. And it's really comes as a shock to many people. But the good news is, 80% of those strokes are probably preventable. And we're going to get to that in a few minutes. But first, let's talk about what puts some women at more risk than others. Number one for sure is high blood pressure. So 1 in 3 women have high blood pressure, and only about half of it have it under control. And control is relative, like we saw in that earlier study. Just because you have your blood pressure under control doesn't mean you're changing all risks. And then certain types of birth control medication clearly also play a role. And these are very commonly used in women of all ages. It's one of the main contributing factors to younger women having strokes, but it's also a contributor to older women postmenopausally who are on some sort of estrogen replacement therapy, or sometimes oral contraceptives for perimenopausal or menopausal concerns. Race also plays a role in stroke. An African American or African Canadian much more likely to have a stroke than any other group, especially in women in North America. They're also more likely to have strokes at a younger age. They generally, as a group, have higher rates of blood pressure and obesity and diabetes, and they tend to be more sensitive to electrolyte water issues. They also have a much higher likelihood of having sickle cell disease. That's a common genetic disorder in Africans, and that can also lead to a stroke because it basically affects the way that red blood cells are shaped, and it can make them more prone to clotting. Hispanic people or Latin people also have strokes at younger ages. The average age for a stroke amongst Caucasians is 80, but amongst Latin Americans or Latin Canadians, it's 67. It's quite marked. And there is some investigations as to why certain ethnic groups are at higher risk, but I really do believe it's quite likely to be diet matching, and obviously social factors, because some of the minorities have socioeconomic challenges. I mean, we certainly see this still in Canada. It's more marked, I think, in the US, especially for African Americans. But we also see people who have had a disconnect from what would normally have been their ethnic diet to their North Americanized diet. And nowhere is that more likely than for people with African descent. It's very difficult to even know where the average person came from Africa if they didn't emigrate directly, and if they've historically come through the slave trade as a major example. Sometimes very difficult to even know where their gene pool in Africa is really from. So that can vary a lot. Just like in Caucasians, it varies a lot, from somebody who's English or Norwegian or Italian. Those are different Caucasian ethnicities, but the dietary strategies can be different. So you always have to be aware that everybody in Canada basically eats the same 10, 15 things, even though we're from everywhere else. And sometimes that can come back to bite you a little bit. So here's my prevention diet harping page. And, like I said, I'm at the risk of sounding like a broken record, but it is very clear that most strokes actually have to do with how well you're eating and drinking. And it's not rocket science, but of course it has its challenges. So the best approach is to drink water and feed yourself right. And there's definitely some basic rules. I mean, for one, don't eat things that are fried or heat damaged. It's really damaging to fats, and it creates a set of toxins directly related to vessel damage, because you're basically circulating those oxidized, damaged fats in your system, and you have to respond to those. They don't just kind of keep on rolling around and then get excreted perfectly. That's not the case. So it's been shown that modern diets that are largely heat processed have a lot of advanced glycation end products. That's also known as AGEs. And So dietary advanced glycation end products really do contribute to oxidation, stress, and inflammation. And they're very related to diabetes and very related to cardiovascular disease, and certainly as a subsection stroke. Dry heat really promotes that formation. So if you compare a very heat processed food to an uncooked food, it'll increase those products by over 10 to 100 fold above the uncooked state. And it's particularly animal derived foods high in fat and protein that become glycation end product rich and that are most prone to that. So if you look at vegetables or fruits or whole grains or milk, you're not going to see very many of those in there even after cooking. But on the positive side, if you cook with moist heat like steaming, or you use shorter cooking times, you cook at lower temperatures, or even if you put like acidic ingredients in your dish like lemon juice or vinegar, you're actually going to improve how many of those advanced glycation end products you're going to get. I think another main mistake people make is they don't balance saturated fats like butter and meat against the ones that are unsaturated, like olive oil or fish oils or flaxseed or avocado oil. I think you can also include raw whole nuts. This really helps if you are not eating fat damaged oxidized nuts. So not like the roasted to death peanuts in the grocery store. Those actually can create advanced glycation end products in them. But things like raw walnuts, sometimes they can be a little harder on the GI. You might need to soak them if you're a bit sensitive. But what you'll find is that that actually decreases the risk of stroke if you eat those things. And, many of you who are patients will know that I prefer to do metabolic typing when we start to see these results showing up, because what it's really telling you is there are things that you're eating that don't work. And it's unfortunate because, obviously all of us have families. We all have expectations around us about foodstuffs. We have our own desires and expectations about foodstuffs. But there are times where people are just eating the things that are literally creating the problem. And so you need to work overtime on making sure that you are eating what's matched to you. Now, of course, we want to lower blood pressure. And ideally, your blood pressure would be less than 135/85. And like I said before, to reduce your blood pressure, stay well hydrated. Have a good water salt balance. And be really careful about advanced glycation end products and an imbalanced saturate to polyunsaturated dietary intake. Eating tons of fruits and vegetables every day and making sure to eat fish a couple times a week, if that's appropriate for you, is extremely useful. I think you probably have all seen my ideal plate guide, where we're really looking at trying to fill half of your plate with non-starchy vegetables, and about 11% of your overall intake with fruit maximum, and about 11% of your intake starchy vegetables and other carbohydrates, and about 25% good quality fats and proteins, with a little bit of salts or seaweeds and a little bit of ferment. That's the ideal plate. And so literally all of these conditions where we see metabolic stress creating problems can usually be reversed by doing that. And it sounds relatively easy, and in reality it would be, if for most people, if they just stuck to it. But the drugs actually don't reverse it. And sometimes they give you obviously decreased risks for multiple things, but they cannot actually reverse your stroke risk very well. Now, losing some weight will also help, because fat is like an inflammatory organ. So it's like you're wearing an inflammation, and that creates increased complications. So there's lots of things that are linked to obesity, like high blood pressure, like diabetes. It basically raises your odds of having a stroke if you're overweight. So if you lose as little as 10 pounds, it can have a real impact on your risk of stroke. So work with somebody that you trust to create a weight loss strategy if you're in an unhealthy range. And like I said, there's no miracle cures. You have to do these things intentionally, and then you have to follow them up with good maintenance that's appropriate for you. So I encourage anybody who feels like they have 10 pounds to lose to do that, because it's a major reducer of risk. And I know there's many amongst you who are actively working on that, that are in my practice. And that is actually that's a great thing. You're actually reducing your stroke risk and your hypertension risk, and levels probably. Of course, physical activity is a great prevention. Exercise contributes to weight loss. It helps to lower your blood pressure, but it also stands alone as a stroke reducer. So, and it doesn't have to be huge. You can just take a walk around your neighborhood. Really. If you have a dog, you can take the dog, or you can, you could even walk somebody else's dog. You could try an exercise class. You can take the stairs instead of an elevator. You can park a little farther away from the shopping mall, especially at this time of the year. You're going to be parking far away from the shopping mall anyway. So you could use it as a walk. I mean, I guess all of us are a little bit more trepidatious with the condition of some of the parking lots in winter. But when you do exercise, you're going to try and reach a level where you can still speak, but you're breathing a little bit more than usual. And you're going to aim for about 30 minutes per day. If you can't block it out in 30 consecutive minutes, just break it up into 10 or 15-minute sessions through the day. First thing in the morning, lunchtime, maybe a little bit after dinner. And going grocery shopping, going to the mall is a great place actually to get exercise if you're feeling a little unsteady on your feet. There's absolutely no reason why you can't do that at the mall. I feel like I get a lot of walking done when I go shopping. Also, like I was saying before, there is that subset of stroke that is related to atrial fibrillation. And so you are probably 5 times more likely to suffer stroke with untreated atrial fibrillation. So you should actually take that treatment quite seriously. Of course, a true fibrillation is on the rarer side. But if you have that, it's definitely worth doing what needs to be done to smooth it out, because it does increase your risk, especially if you have other risk factors on top of that. Now, if you have diabetes, you're also going to want to do your best to treat that. And again, normally I would prescribe metabolic typing for that to get people closer to where they need to be to balance those blood sugars. And we have now like the capacity to do continuous glucose monitoring with, so this person is showing using a blood drop stick, but now we have ones that actually tape onto you with a little needle that you're wearing that basically Bluetooths to your smartphone, which is amazing. And so people have much better readings on blood sugars when they use one of those, and they do a better job usually of improving their blood sugars. And they also can learn other reasons why their blood sugar goes up and down. So this is one of the reasons why you're starting to see people realizing that stressors have an impact on your blood sugar. And when you have too much uncontrolled blood sugar levels, like I've told you before, it does actually increase the stress on the blood vessels and does damage them. And so it's a major risk factor for cardiovascular disease to have diabetes. That's basically where your metabolism is broken down to the point where you don't have great glucose control. And that is not always caused by you eating too much sugar. It can be exacerbated by that, but it can sometimes be that you just don't eat the right balance of things for you. So about 1 in 3 people have pre-diabetes, and 90% of those people probably don't know. So you can actually do some investigations of that. Your family physician can run those kinds of labs, and I can run those kind of labs for you as well. Now, sorry, this slide got a little bit screwed up there, but it's quitting smoking is a great idea. smoking is a huge oxidative stress. So it's another thing that actually stresses out the blood vessels quite a bit. It's kind of like taking that heat roasted meat in. It's a similar sort of mechanism. You're actually damaging your blood vessels. You're also often affecting blood clotting with cigarette smoking. So if you quit smoking, it's one of the most powerful lifestyle changes that can reduce stroke risk. It's a major increaser of all cardiovascular risks. And if you've seen those risk charts in my office where I show you the difference between men, women, different decades, smoking versus non-smoking, and diabetes versus non-diabetic, you'll see that the diabetes and the smoking, the male gender, and increase in age, those all are major cardiovascular increasers. But you can also be in your decade of age without blood pressure problems, without smoking, without diabetes, and be in a normal risk range. But if you are one of those unlucky people who is still smoking, it is definitely worth having, having the discussion with your primary care about how to come off. Now, I'm put here prevention supplements at the very end. And the reason why I put it at the very end is that I would never want somebody to start with this. It's true that there are certain things that have good evidence for them. They can definitely help when stroke risks are increased by inflammatory processes, but they really are a last resort. They will not make things all better by themselves, just like the drugs don't fix a bad diet. So here's a list of things that you could consider. One is dietary flavonols. So flavonols are, well, where do they come from? They're basically coming from food. So they're coming from things like grapes or green tea or turmeric or cinnamon or cacao or dark chocolate, otherwise known as dark chocolate, or berries. So you can actually buy flavonols that are extracted from those foods, or you could just eat the food, which is probably a better management strategy long term. However, it has been shown by research that the more flavonols that you eat, the less your stroke risk is over time, for sure. The second thing is like hesperidin. You may have heard of that molecule before. That improves endothelial function. Of course, that also comes from foods. So it comes from onions and garlic. That's probably the highest natural amount for people, but there's lots of foods that have hesperidin in it. Resveratrol, lots of people have heard of resveratrol. That's something that has historically been pulled out of grape skins. That is a molecule that is especially decreasing stroke risk in those with impaired glucose tolerance. So if you have diabetes, resveratrol is a well-indicated supplement. CoQ10 is another one that'll improve stroke risk. It improves vessel damage, basically, and also improves mitochondrial function. There's some metabolic types that do really well with CoQ10. There are others where I wouldn't actually apply it. There's also folic acid, which basically helps if you eat it. And guess what? Most natural vegetables that are green contain it, especially the dark leafy greens. You'll get a lot of folate in those things, but basically most fruits and vegetables have some amount of folic acid in them. So we're basically talking here about your people who are not eating vegetables, that not getting the basic folic acid, but it has such a strong positive effect that you can definitely see the people who eat vegetables. And then vitamin D has some kind of contradictory data, but it definitely seems to improve like fibrosis in blood vessels. So basically that's like disorganized scarring in blood vessels. So vitamin D seems to help that. It doesn't seem to change cardiovascular outcome by itself, but it seems to improve vessel condition. And last but not least, something called benfotiamine. This is a form of vitamin B1 or thiamine. I actually usually use this in people who are having nerve pain. But if you're like, again, especially at-risk population, like you have diabetes or you have chronic kidney disease, B1 can actually really help decrease your stroke risk. So like I said, they're very useful. It'd be great if you just ate those things. that would be way better than taking the supplement. If you're one of those people who's never going to touch a green vegetable in their life, of course, that's a different conversation. But best case scenario, you would actually be eating those things and preventing your risk. Okay. So, I am still doing a couple more webinars in this series. I think you'll probably have noticed that I'm not doing them monthly in the same way as I was doing them last year, but there's another 2 for this series, so February and May. We're also doing a couple, I'll show you that in a second here. So we're going to do morning routines in February, and in May we're going to do avoiding EMFs. We're also going to move what I was kind of hoping to do in fall to January. So we're going to do the second Align live event. So it's going to be listening to the body. So stay tuned for that booking in January. And the other webinars I'm going to be giving that you can pass along to other people. I know the people who are listening to stroke risk are probably not in the Dr. Mom category, but we will be doing healthy kids in a toxic world and prenatal testing in this series. So, as usual, thank you for everybody showing up. It means a lot to share information with people who are ready to make healthy changes. And it's certainly time to go eat some green vegetables now. And then reach out if you have any questions or concerns about your own health. And I'm happy to take questions if anybody has any. Anyone? You're stunned into silence. You're all going to go eat your vegetables now. I just know it. It's good to see you all. I appreciate you showing up. Yeah, I know. It's always something to kind of reconsider. You got to reconsider it from every angle. And, you know, it's, like I said, it's not rocket science to do those things that you know you should do. Sometimes people just need a little data, right? All right, awesome. Well, good to see you. Hope you have a good night. What's Akhmatova? Akhmatova. What is that, Rui? Yeah, I understand that, Laura. That's although as you get through, you do tend to get more and more vegetables. Yes, Helma. There was an interesting problem with the title of this speech and what it was actually supposed to be about. And so there was like a weird mismatch there that happened in the Synduit system. And I didn't actually catch it until the end. So I apologize if there was some confusion. But I think there was a whole bunch of stroke messages that were going out. But then there was some confusing ones about rebuilding the brain. And we did actually cover rebuilding the brain in concussion. We have not really covered things to do in neurological diseases. That's a different set of problems. What do you do after stroke? You basically go to the hospital first because you need blood thinners and stuff. And then you need to correct your diet, really. Like it's basically showing you need to decrease inflammation in your body. And if you, like I said, you can use some of that supplementation to decrease risk, but it really comes down to making the lifestyle improvements that you need to make to undo your risks. All right, so I hope you all have a wonderful evening. I will talk to you soon. See you at the next webinar. Bye, guys. Thanks for watching. I love to connect to my patient community to inform and inspire, and I hope you'll join us again in the near future. Don't forget to check out whole-life-medicine.com for more webinars and events.